Live from the Business RadioX studio in Atlanta, it's time for Dental Business Radio. Brought to you by Practice Quotient. Practice Quotient bridges the gap between the provider and payer communities. Now here's your host, Patrick O'Rourke.
Hi there, those out there in Dental Business Radio land. We are here live at the 6th Annual Insurance Extravaganza with lots of people all around. They're very happy to, make some noise and provide all sorts of comments and feedback to our show. And that's what makes it fun being live, right? And so I am here with Kandra Sellers. Kandra, what do you think about all of our friends that have their opinions?
I love all the encouragement.
Yes, they're cheering for you. They're definitely not cheering for me. That is for sure. All right. So, as we're here at the 6th Annual Insurance Extravaganza, you are one of the speakers. You'll be speaking tomorrow, and your topic is Introduction to Medical Billing.
That's right.
So, explain this to me like I'm 5.
Oh, goodness. Well, it's pretty simple. You can bill to medical insurance for many of the things that we do in dental.
Like, give me some very common examples.
Exams, CTs, Panorexes, tomographic studies, advanced oral cancer screening, fluoride treatments, implants, bone graft, interim prosthesis, final prosthesis, frenectomies, biopsies, cyst removals, wisdom teeth extractions, sleep appliances, TMJ appliances, Botox for TMJ. Is that enough?
That is. That's very impressive. Very impressive. And so now my next question is, we can bill. Now, are we going to get paid?
Yes.
And if we are going to get paid, how much are we going to get paid?
Well, the reimbursement is going to be different for every payer, every state, every procedure, obviously. But in my experience, comparing a provider who is in network on the dental side and medical side for the same payer, the reimbursement on the medical side is anywhere between 2 and 12 times higher.
Really? Okay.
That's right. And you lose all the limitations of, you can only do, say, a PAN or FMX every 3 to 5 years. You could take a PAN every year as a maxillofacial and oral cancer screening.
Gotcha.
So we lose all those maximums. We don't, there's no $1,000 limit per year. You could take a CT every day as long as it was medically necessary to do so. So you lose all those limitations.
Does there have to be a condition for the patient, though, in order for them to get, nobody wants to do a CT scan every day, but let's just say that they needed a lot of services that would be limited by frequencies. But it has to be medically necessary, meaning that there is some sort of underlying condition.
Well, you're thinking dental likely. Like, do they need a lot of dental restorations because, say, they had...
Well, let's say that they have diabetes, or let's say that they just they have a decaying bone disease.
Well, okay, so if you're talking about dental in nature things that you're trying to get medical to pay for, they're not going to pay for it unless there is a medical condition attached to it. So, because it's dental in nature, not medical in nature. So say it's somebody that has had a destroyed dentition because they're on chemotherapy,
okay,
which is very common.
Sure.
Absolutely medical. Well, I shouldn't say absolutely, because there's always one plan that excludes things. But and I've had that happen. But in that scenario, more than likely, medical is going to pay for all of the full mouth restorations that are necessary, because it was the condition, the systemic condition, and the treatment for that systemic condition that caused the destruction.
That makes sense. That makes sense. And so, are you finding that a lot of the providers that you speak with are in network with the medical?
No.
No? Out of network?
Most are out of network. Every once in a while, I'll have maybe an oral surgeon that's in network. I do have one client down in Louisiana and in some states, if you are in network with your local Blue, they're automatically in network. For the dental side, they're automatically in network for the medical side as well.
Very
But
clever,
there's like Louisiana's one, Kansas is one. I don't know if any other states in particular.
Some folks don't understand. And for
And
those
they-
out there in listener land, Blues are not the same. There's actually 36 different Blues in this country.
Yeah, and they're all different franchises. But I look at them as a franchise, really. That's what it makes sense to others. When I talk to my clients that are in different states, I find that they can't understand the Blues either. But when I say, well, they're part of this franchise over here, like Illinois has Illinois, Texas, New Mexico, and I don't know what other couple states they have. There's about 5. Anthem has Ohio and
But
Colorado
Anthem
and
has
California.
rights in
And
13 states,
yeah.
so they're the biggest one.
Yeah.
So here's how I compare them. All right. And I think that all of my friends at the Blue Crosses would agree with this analogy. Okay.
I would love another analogy because they're tricky.
I go, look, let's think about them like a family. Okay. They're really dysfunctional. All right. They don't get together for the holidays. Not all together anyway. Certainly not family reunions, sometimes maybe, but they bicker a lot. They infringe on each other's territory. There's different factions of the family, just like the DNOA faction, Illinois, that you were, Texas, that you were just talking about. And so they're family, and so that's kind of how I explain it to folks.
Yeah. I mean, when you cross a state border, it's likely going to be a different Blue Cross, and they have a whole different ballgame. It's just is what it is. But once you figure out what I always say, the hardest carrier to figure out in any state is Blue Cross, because they're different in every state. And while unless they're all Anthem, then they're all going to kind of follow the same guidelines, just like a United.
Anthem, also known as WellPoint, also known now as Elevance.
Oh, I haven't heard that one yet. That one hasn't come up
this
yet.
This is the new one, and they acquired Emblem, and so sometimes they still call some of the acquired companies the other company's name, like Blue Cross of Georgia. People say Blue Cross of Georgia, which is Anthem.
Well, at least with United Healthcare, they're gobbling up all the payers too. They're UMR, they're Sures, they're I don't even know. They have so many different ones, but they at least all have the same names. They keep the same names.
Right.
I don't know, but it's very confusing. They're all kind of joining.
It is very confusing. I think it's either an exercise for our mind puzzle, or they have some really expensive marketing people, and they need to make sure that they are getting their bills paid.
Yeah, I'm not sure.
But I do like the word Elevance. It's sort of like Duval. Little Bucks joke there. As we are in near Tampa. Anyway, I digress, Candace. But back to you.
That's okay.
All right. So, do you find when you go to these that people get excited about medical billing?
I do.
All right. And then when they go back, do they do it themselves? Like, how does it work?
So my niche, and what I really felt was needed in the industry, was support with implementation, because it's real easy to go to a 2-day seminar on medical billing and get the fire hose method, basically, of all the information that you could possibly need to actually take this back to your practice, but most of them do not, because they don't even know where to start.
Sure.
Because while it's the same RCM process as dental, it's just different. And people have been brainwashed by, this little thing called dental benefits, and they don't realize it's different. It's different than dental benefits. When we get to the frequencies, when we get to all of these limitations that dental has,
if it's not covered, then I don't need it.
Exactly.
They would never put together a plan that didn't give me what I need, because there's some smart folks over there. Teresa Duncan and I were just talking about this. The employer group is the one that they create the coverage, right? And so in concert with their benefits administrator, But the simple truth is this. Some companies care more about their employees than others.
Absolutely.
Let me put this a more fair way. They don't have the budget for it. So you can put whatever you want, but you still have to price it. You have to price the risk of what can happen on claims. And so you can make the benefits stricter, right? And that makes the premium go lower. And then the employer group contract supersedes everything else.
Right.
And so there's no real universal rules for any insurance company anywhere. The great thing about this business is that there's always exceptions. The awful thing about this business is there's always exceptions. And in the medical world, it's the same thing.
Yeah.
Right? So
Yes. Well, I think in dentistry, there's so many things that are not covered by dental. And so practices end up writing it off, or the allowed amounts are so much lower than medical. I mean, we use the NDAS to come up with fees for practices often.
Okay.
But that's a dental thing. That's not how medicine rolls. We're the only medical specialty that has its own little groove going on here with a dental benefit. Everybody else goes to
I don't necessarily
medical.
think this is all bad.
Well, there's definitely a place for it. I'm not saying that. It's just we've allowed it to dictate everything about our practices, how much we charge, when we charge, how often we charge.
This is
true. And our patients have trained us to give them to the penny what they're going to owe, and if we go over the penny, they're ticked off about it. We've just put ourselves in this box of you only have this much benefit this year, so guess what? That's all we're going to do. Or it doesn't make any sense. That's not how medicine works. Medicine, you go in for a procedure and you haven't even met half your providers, let alone know what anything is going to cost when you come out.
True.
You come in, you come out, and you work out a payment plan with the hospital, and you're good to go. And you start receiving bills from a lot of people that you didn't meet because you were under anesthesia, like the anesthesiologist you met for a second before they put the mask on for you to go sleep. You have labs, you have radiologists, you have, your doctor, you have the nursing, nurses in there, and then it's just it's wild. Yeah, then you got your RXs coming through. I mean, you start receiving all these bills from people you didn't even know were in the room. I mean, that's for real, and nobody talked to you about how much that was going to cost.
That's very good. Yep, that's a very good point.
And we just do it because we need it. But when it comes to dental, we question it.
That's a very good point. And so could be arbitrary, it may not, but because we're all unique human beings, that plan summary or what's covered and not covered may not be indicative of your needs as an individual. Right? So let's go back to this point you made, is I hear this a lot, is that folks come to because people think I'm an expert on medical billing, or for some reason, just because I'm from insurance, and I'm like, I'm on the other side. Like I've never submitted a bill in my life, Anyway, and so medical billing is certainly not our swim lane. But I know that a lot of folks, they come to Insurance Extravaganza, they hear you speak, and then they get excited, and then they get back, and then they don't know what to do. And so what should they be doing, or how do you help them go from, well, that was nice to know, to actually implementing and getting that initial ball rolling?
So that's my niche, is I am that person that helps them every step of the way so they don't have to flounder through the process. And every practice has a different philosophy, every practice has a different workflow, and everything I do is customized to them. So whatever it takes, we make it happen.
And so if I want to reach you either through the Insurance Extravaganza or after the Insurance Extravaganza, or if I didn't even come here to Orlando and I'm listening to the podcast here on Dental Business Radio, be sure to like and put nice things in there. listener land. But if they want to talk to you more about that, because maybe they saw some medical billing stuff, how do they find you?
The best way is to reach out to me on my website, which is TIPS, so TIPS, medicalbilling.com. On the contact form, just fill out your information, and I will reach out to you probably the same day.
Okay, that's awesome.
And we will have a one-on-one conversation about if medical billing is something that is a good fit for you.
Absolutely. And for those out there in listener land, I have known Kandra and her husband, John, shout out to John Sellers, one of my favorite people in the world, for many years, and trust them implicitly. So if you want to talk to somebody who's going to give you the straight dope on medical billing and it's fit for you, then you should give Kandra a call. Kandra,
awesome.
Thank you very much for coming up on the show. And
absolutely,
download it. Now you're a dental business alumni. You're welcome.
All right.
So for all those in listener land, until next time.
Awesome.